Okay, so I just walked the patient to a room, watching his gait, assessing his speech, see if there was any slurring or anything, and I asked him his name and date of birth, and what brought him to the hospital today, and if he knew where he was, and he was alert and oriented, +4. Then I took his vital signs, and now we're going to start the head-to-toe assessment. I'm going to start looking in his hair and check for any hair loss or infestations. And then I'm going to move to the eyes. If you could please take your glasses off for me. Can you follow my pen light? All right. I'm just going to shine a light in your eye. All right, so eyes were perla. That means pupils equal, round, reactive to light, and accommodating. And they weren't jumping around or anything, so they looked good. And then I would look in his nose and ears, and can you open your mouth and say ah? All right, everything looks good. So his skin temperature is warm and dry, and then I'm going to move down to the carotid artery, and I'm going to palpate that one side at a time so we don't cut off blood flow to the brain. Good. All right, perfect. Now I'm going to check the skin for turgor. I'm just going to pinch right here and watch the skin bounce back, and that's good. And then I'm going to listen to the heart sounds for a full cycle, the aorta, the pulmonic, and then Erb's point, and the tricuspid, and the mitral. And this is where you would listen to the apical heart rate for 60 seconds, a full minute. You're going to listen to that both with the diaphragm and the bell. And the diaphragm, you'll hear your S1 and S2 sounds and all of the higher sounds. And then with the bell, you're listening for heart murmurs, so that listens for the lower sounds. And then you're going to listen to breath sounds on the chest. So you're going to do that comparing each side. All right, if you could please lean forward, you're going to do the same thing on the back in a ladder-like fashion, avoiding the scapula. And you're listening for any advantageous breath sounds like crackles, wheezes, friction rub. All right, sounds good. Thank you. All right, and then I'm going to go to the upper extremities. I'm going to check for temperature, it's warm and dry. Then I'm going to do the radial pulses bilaterally. All right, 2+, that's great. I'm going to look at the nails, do a capillary refill. Perfect. All right, so you're looking for that color to return in 2 to 3 seconds, or less than 2 to 3 seconds. Then if you can lay back, I would do the abdomen. And I'm just explaining this right now, I'm not going to lay you completely back. All right, so first you would inspect the abdomen for contour, symmetry, and the skin integrity. And then you would listen in all 4 quadrants with your diaphragm for bowel sounds. And then you would listen to the aorta, which you already checked to make sure it wasn't pulsating. But you're making sure that's good. Okay, and then you might want to listen to the femoral artery or the iliac. All right, and then only after listening you would palpate all 4 quadrants. Alright, and then we're going to move to the lower extremities, and we're going to look for any edema, discoloration. If there's edema, you're going to check for pitting, and then grade that accordingly. And then you're going to check the pedal pulses, and they look good. Could you hang your legs over the side of the bed, please? We're going to check the musculoskeletal system. Alright, can you squeeze my fingers? Alright, put your hands like this. Alright, don't let me push them back. Alright, like this. Yeah, it's fine. Don't let me push them down. And then like this. Don't let me push them apart. Great. And then I'm going to do the same with the legs. Don't let me push them back. And then don't go forward. I'm going easy on his legs because he just had surgery. And that's all for the assessment. Do you need anything else? All right, thank you. The doctor will be in just a minute. So in my video, I forgot to say that I would wash my hands when I enter the room before I start my assessment. And I forgot to do the capillary refill on the big toes as well at the end of the assessment. And I would do that after checking for the pedal pulses. Thank you. And after my assessment's done, I'm going to document, and that's it. Thank you.